week. Dr. Ann Kahn is from the North Shore, went to LSU undergrad, finished in chemical engineering, and came back to med school here with us. Did training in neurology, is triple boarded in neurology, pain management, and headache. And she was actually, not too many years ago, but it really was a few years ago, she was a medical student who worked with me on the adult inpatient ward. And we got reconnected over the years recently, and she'll tell her story how. But I wanted to welcome her, welcome you all, especially the students. I think you will find psychiatry different in some ways from your other rotations, but hopefully tying it all together. And that's what Dr. Kahn is going to do for us, with us today. She doesn't have a PowerPoint. She's going to be doing a unique approach that you'll hear about. She'll explain. And she doesn't have any disclosures. There's no conflicts of interest, nothing to disclose. So thank you. And we're going to probably try to finish with enough time for a few questions and answers, okay?
Can everybody hear me?
Yeah.
Okay. Thank you very much, Dr. Dyer. It's a pleasure to see you again. So of course I'm hoping y'all will be a soft crowd today. As my faults and pains will be on full display, please be gentle. Perhaps I'm still one of the parents that talks about their children too much. In the world of the Kardashians, where everybody...
They said they can't hear you enough. Should we just use the hand mic because we changed the batteries? Huh? It's on, and we changed the batteries, but it doesn't sound very loud. So the hand mic.
Okay.
Is that better, or should she just hold it?
Is this better?
Yes.
Okay. So I said even in the world of the Kardashians, there are some things that aren't talked about enough. And in my mind, that's suicide, loss, survivorship. And that's the subject for today. And suicide is a difficult subject even for medical professionals. Is that better? Can you hear me now? Okay. I said suicide is a difficult topic even for medical professionals to talk about. My hope today is that a small part of our experience will inform your life, your practice, and your patient care. I'm inviting you all to enter the experience with me, the journey of the illness and death of my two sons. If I was a painter or a sculptor, I suppose I would have painted or sculpted our story. We each work in our preferred medium, but I'm a doctor, and so I lived our life in bipolar disorder as a doctor and interpreting it through my expertise. By reading medical journals, books, using my knowledge to help negotiate the medical system, and the psychiatric medical system is difficult to negotiate even when one knows how. Then I began writing, journaling during the time of their illness, and ultimately I've written a manuscript about our experience. Today I'm choosing to present in a narrative format. I'm using what we call a narrative medicine, or I hope to use this technique. The definition is a medical approach that utilizes people's narratives in clinical practice, research, and education as a way to promote healing. Really, it's our shared humanity that heals. And so that's why I'm going to use a story format today. And ours is a story of treatment unresponsive lethal brain illness. And part of our story is of psychosis. Bipolar psychosis sometimes is associated with bipolar illness. Most people find psychosis frightening. It is an extreme state of mind, and it's far from the common experience for most of us. Perhaps your mind, some of our minds go to memories of seeing homeless people on the street muttering and pacing. I'm trying to discuss psychosis to help decrease the stigma of mental illness. This is just one part of trying to decrease the stigma. I think we're at an exciting time because the stigma is starting to switch. And I think many people in the general population at least have some concept of depression, and they can think about that. But there still remain areas where people really don't have an understanding. Psychosis is impenetrable for most. Right next door at the old Charity Hospital is where I first saw patients hallucinating and experienced psychosis. When I did my general neurology training, we consulted on people hallucinating in the hospital with Parkinson's dementia, Parkinson's psychosis. We also consulted on patients with their first psychotic break. And I had no idea this was preparation for me to talk with my sons during their psychotic illness, but it actually was. And it helped me in ways I could have never anticipated. And later, I received an education that I wasn't really wanting when I learned more and more about psychosis. And it actually was still frightening to me as I learned more, and I'll explain why and how that all happened. How do we respond when we see people doing and saying things that are inexplicable? Well, there's no easy answer. So we all like easy answers, and they're quite seductive. But when we take the bait of the easy answers, that requires denying some part of reality. So I'd ask you all to refrain and try to take in the big picture as much as you can to go through that process. When I was preparing for this talk, a well-meaning person advised, don't go into too many details of your story. People won't be able to take it. Of course, I found that darkly amusing. And everything can't be discussed, so I'm trying to just summarize some key succinct parts to help communicate some of what happened. So how did our story start? Like so many stories of mental illness in our area, it started with Hurricane Katrina. My older son, Austin, a gifted student and athlete, had a depression after Hurricane Katrina. My house was totaled by a tornado, and my son's father and I had just divorced. So his depression seemed understandable. And some of you may remember how common depression was in our society during that time. But what was unusual during that depression is he developed a symptom of suspiciousness, which was so counter to his nature. He said some things like, well, I can't trust people. I thought that was unusual. I was worried by that symptom. He did see a psychiatrist, get medicines, and he made a recovery. His excellent grades returned. He functioned better socially, but yet in some way he was never quite the same. He didn't make a complete recovery in a subtle kind of a way that's hard to communicate, but as his mother, I knew that. And 2 years later, he had another depression while in summer school in Europe. And when he returned from that trip, he was withdrawn, oddly congruent, and somehow detached. And again, he recovered, but his recovery was even not to that same level. It was slower. It was slowly devolving. And as is common with bipolar disorder, oftentimes people will have depressive episodes before the illness fully reveals itself. And that can lead to, it makes the disease difficult to diagnose, and it can lead to misdiagnosis. The next summer, my younger son went to summer school in Italy. And I visited him actually with a colleague that I trained with here in neurology. And he seemed overjoyed there. He seemed to be having a wonderful time. But in fact, it was manic joy running over him. And when he returned from Italy, he had a very odd complaint that I didn't understand. He came home saying, I'm not myself. And I was like, Colin, what does that mean, you're not yourself? And initially, for the first few weeks, I thought he was jet lagged, but it became clear he was actually going into a depression. He resumed school that September of '09, and he would not go to the doctor. He had actually seen a psychiatrist once in high school for what looked to me like a mild depression and responded at that time. But he just absolutely refused to go to the doctor, and I begged him 9 ways to never, and he wouldn't go. I began driving to Baton Rouge several times a week, checking on him. I felt like he was devolving. And toward the very end of the semester, he complained one day on the phone. He said, I didn't recognize my face in the mirror this morning. I found this shocking, but it was familiar to me in some way. And it was a few weeks later that I actually remembered that in medical school on my psychiatry rotation, I was studying Kaplan and Sadek, that can be a sign of psychosis. And at the time when he told me that, I was disturbed a bit. And I was alarmed, but it took me a few weeks to process it. And I think that was probably really denial on my part, because when I remembered it was after he had been hospitalized. So about a week after that, he just called me on the phone and said, "Come get me, I need to be isolated." So I had just finished surgery, I jumped in the car and drove to Baton Rouge. And I was really lucky because Gordon Blundell is an excellent community psychiatrist who's a friend, and he had actually coached Colin in basketball. He and Colin with his son like 10 years before. Because even as a doctor, you don't know what to do during these times. But I knew Dr. Blundell personally. I called and left a message. I'm like, "Something is terribly wrong with Colin. Can you please see him?" And we decided he needed to be hospitalized, and he arranged for him to go to McLean in Boston, which is an excellent facility. Very famous, lots of famous people have been there. Sylvia Plath, Robert Lowell, Steven Tyler, James Taylor. And when he was there, he received the diagnosis of bipolar disorder type 1 with a psychotic episode. And he had been secretly psychotic since like the end of August. And this was just shocking to me because that he would drop hints that I didn't recognize him, and that he didn't come right out and tell me this. And I mean, he could have died without me knowing he was psychotic. And so I'm really grateful that I did learn that, and a lot of other things transpired since then, that I was shocked by knowing he was psychotic. Our world was rearranged. And even though all this had happened and he had become psychotic, he was still given a good prognosis. While he was there, he chose to participate in functional MRI studies for patients with acute psychotic bipolar disorder that were later published. Later, I learned it takes a year for the brain to recover from the trauma of psychosis. But we learned that the hard way. The higher the high, the lower the low, they say. So he had a huge mania, and now he was, then it became a psychosis, and now he paid with a depression, and it was a treatment-unresponsive depression. And I think he was probably non-compliant with his medicine during that time. And then I started, thinking about what had happened. There is a history of bipolar disorder in our family. And when he was in high school, I thought he probably had bipolar disorder. And I mean, this is a tough call because a high school kid that's really excitable and irritable, in my heart of hearts, I thought he had bipolar disorder. I was just hoping it was bipolar disorder type 2, or cyclothymia or something, and it didn't turn out to be the case. Well, by the summer of 2010, he had a very dangerous suicide attempt, and he went to Meneders in Houston. And he got excellent care at Meneders. He was treated with the kind of dignity that you would want a family member, a loved one, or anybody to be treated with when they have a serious mental illness. Unfortunately, 6 weeks into the hospitalization, he began having rapid cycling, and he had a psychotic episode. The rapid cycling is when the mood is really uncontrolled in bipolar disorder, and they're just flipping back from mania to depression. And he was rapid cycling so fast it was happening that you could watch it happen. It was terrible. And I'll go into a little detail here. So he was on a voluntary commitment, and the psychiatrist said if he tried to check out, they were going to have a forced commitment. And they documented all that in the chart. Well, our insurer refused to continue to pay. They said it was not medically necessary. Of course, I was furious. We went through all the denial process with Magellan, maybe some of you all are familiar with that. And we went all the way through all the appeals, and it was still denied, even though he was psychotic and rapid cycling. They wouldn't pay the admission. And really, and it's still like this, we really didn't have a recourse because the people at Meneders told us that they had never seen anybody win a case like this in federal court. And that's where these cases go. So we chose not to pursue it. Because in the meantime, he was terribly ill. And I was the recipient of a poor prognosis talk. really hard to give them, and it's really hard to receive them. And it was done very, it was beautifully done, but nevertheless incredibly painful. And they talked to me about how he was a poor medicine responder and he would likely be chronically suicidal the rest of his life. And so at this juncture, we needed transitional care community. And in 1963, when President Kennedy signed the Deinstitutionalization Act, because there were too many people in long-term psychiatric care, there was a promised community care system to be built. And to this day, it's never been built. The need certainly has not gone away. And at many different junctures in our journey, we desperately needed that system that is still not present. During this time, one of the staff at Menninger's recommended this book called Recovering Sanity. And it was really important. It gave me a lot of hope at that time. It taught me a lot of things. So the book does case studies by 3 just extraordinary people, where they took the writings of these people and they were able to describe their psychotic process. It must be incredibly difficult to do. And the one I think that touched us most deeply was this guy, John Percival. Percival came from a very wealthy British family, and in 1838, he published a book by this title. I'm going to read the title because it's so extraordinary. A narrative of the treatment experienced by a gentleman during a state of mental derangement designed to explain the causes and nature of insanity and to expose the injudicious conduct pursued toward many unfortunate sufferers under that calamity. But this book really ended up being a societal landmark because he later founded the alleged Lunatic Friends Society in 1845 and started the movement in Europe for reform of psychiatric care. Because injudicious treatment is an understatement. He was waterboarded, shocked, tied to his bed for days at a time, subject to a surgery to sever his temporal artery. But while literally being tortured, he discovered what he called islands of clarity. And these were moments of sanity during his basically status psychosis. And without medicines, without help, tortured, he was able to cling on to these islands of sanity and battle back. And he eventually was released, and he became one of the first important advocates for mental health care in Europe. But reading this material, this level of detail from him and another writer, Henry Marshall, was very difficult for me because the details of the psychotic experience were utterly excruciating. And when I thought of my child experiencing this, it was intolerable to me. I got a glimpse into that world, the Faulkner's world of sound and fury. Edna St. Vincent Millay, a bipolar sufferer herself, wrote, "The soul can split the sky in two and let the face of God shine through." This she wrote of her manic episode, one of her manic episodes, but for some, the sky caves in. So when Colin came home, he started talking to me about the details of his mania. That contained, as they often do, mystical and religious experience, a glimpse into the immensity of time and space. He described his sense organs as more acute, clarity and smell and bodily sensations, like enhanced vision, manifestations of emotional and intellectual intuition beyond ordinary knowledge. So this mania, it's got to feel unbelievable. But then, of course, it can go into psychosis, which it did for him. Unlike the hallucinations of medical illness, many medical illnesses, the hallucinations of psychosis are often persecutory and harassing for the individual. And actually, both of my sons had hallucinatory voices disembodied that would yell at them, "Kill yourself." That's so hard to withstand. And so now I'm going to talk as a little bit as a neurologist about psychosis. Psychosis is primitive agony that arises from the deepest part of the brain, the terra of the reptile brain, unregulated by considered thought, raw, visceral, turbulent. Those who lived through it return to describe it as such, and these are ancient miseries. They've been recorded in Chinese manuscripts, Egyptian medical documents in 1500 BCE, and in modern times we're still trying to solve the puzzle of psychosis with our sophisticated MRIs, PET scans, collection analysis of genetic data, but much of it still remains uncharted. So I'm going to use some anthropomorphic language when I talk about the brain here because it's easier. All animals, the human animal, we conceptualize our reality by interactions. We interact with the environment. And our images of reality are only approximations. We're deluged with so much sensory stimulation in the brain, in effect, we must choose what to pay attention to because, quote, there's only so much attention to pay because attention is quite costly energetically for the brain. So how does the brain prioritize? Well, stay alive, right? That's what our biology, we're designed to try to stay alive. So what the brain typically does is pay attention to potential danger in the environment. What's unusual or out of place? Where's the tiger lurking behind the bush? That's what deserves our precious attention. We also predict the future with our brains, and the brain doesn't like surprises, because surprises are energetically expensive. We relate to the world by building our own internal model, and we predict what's happening outside based on that model. So why don't we notice our friend's new haircut? Because we did not expect to see it. And there's a strong bias for the brain to see what it, quote, wants to see. What we see is not just what the eyes take in, but the information is combined with our expectations. And when the brain has unmet expectations, it creates basically small hallucinations. Most of you guys have probably done the little puzzles where your blind spot is revealed and it's clear that the brain is filling in that blind spot. Or maybe the puzzles where there's images with dots and there's a hidden image in the dot. So that can help us notice the prejudices of our brain. But one of the more famous and instructive ones in this context is the hollow mask illusion. So what we do is you have a hollow mask that's concave, and we look into the concave side, but most of us create in our minds an image that is convex. But those with psychotic illness and autism are less likely to do that because their brains don't dismiss information that's less likely to reflect surroundings. So even the healthy, functional brain makes up hallucinatory images. And that's the cost to make reliable sense of the world. So psychosis can be thought about as an inability to predict the environment in a way that supports the function of the individual in society. One way this is explained in what we call the radio analogy. The brain loses the ability to, quote, tune into the station of our shared reality. So when you turn the knob, the brain hears all this white noise with quickly passing voices, and the individual tries to interpret this noise into the reality as previously understood, but the brain can't tune into the station. The tuner doesn't know how to stop, the brakes have failed, and that's the disconnection theory, the lack of synaptic integration. And then, there's Hebb's theory, neurons that fire together, wire together. So what happens, it's thought, is that when people have multiple psychotic episodes, their brain remodels, and they become treatment resistant. And all this is fine to talk about the intellectual part of psychosis. It's certainly valuable and important, but I think it's not good to go too far afield as an individual experience. It must be like Dante's hell. In my opinion, having witnessed it twice in my sons, I think it's one of the worst things that can happen to a person because it must be like being tortured from the inside. So for me, when I started reading and learning all these details about psychosis, it was I really got into empathetic distress because I was imagining what my sons were experiencing. And in a certain way, I think I was experiencing it with them. We have mirror neurons where we empathize with other people, and it was so distressing for me that I actually had to make a decision to protect my own mind because I could not tolerate thinking about that. hearing some of the details of the psychosis. So what helped me during this period and during the entire process? Well, I'm a long-term meditator now. I've been meditating almost 30 years. Of course, I had a lot of therapy because it's so difficult to tolerate this kind of helplessness. It's certainly a spiritual ordeal, and I continue with my spiritual practice. And I have a lot of really close friends I was able to confide in, and I'm so grateful because these kind of episodes can be incredibly isolating because of the stigma. On the other side, deep suffering can open us up to new types of intimacy. Also, I began journaling, which became a manuscript. Meanwhile, back at the ranch, their son Austin was doing really poorly. What I found is I could not think about them both. I literally had to switch. I had to think about one, and I had to think about the other. If I tried to think about them both at the same time, it was too overwhelming for me, so I had to switch my attention back and forth. So after his second depression, he began drinking heavily, and he ended up in treatment, thank goodness. He stayed in alcohol treatment for 9 months. But after several months sober, I began to notice that he had abnormal pressured speech, and he began making erratic decisions. And to my horror, his bipolar illness was unmasked when he got sober. This is a common painful story because 60% of people with bipolar disorder have an addiction, and it delays their diagnosis. And this is certainly what happened in his case. At this time, it was March of 2011. Despite being confronted by multiple people, his friends, his family, his therapist, with 6 hours left to graduate from LSU, he went to California in what I thought was a hypomanic state. And it was very difficult and frightening. Colin, in the meantime, had returned to LSU, resumed his studies. He's a gifted physics student. He took the intention to study nanotechnology in hopes of developing treatment for brain illness. One of his professors said he was one of the best undergraduates he had ever seen. And although he was doing well, all this time he was telling me, I'm just trying to stay alive every day. I would say that LSU Student Health Service helped him stay in school. And he was able to do that, although he received his degree posthumously. So as I'm watching both of my boys terribly ill, handle this myself, and what happened is I read this book by Kay Redfield Jamison called Night Falls Fast. Some of you all may know Kay Redfield Jamison. She's very famous for this book called The Unquiet Mind, which is a standard in psychiatry. Anybody that's going to treat bipolar disorder, a family member, or an interest should read the book. This book, Night Falls Fast, had a huge impact on me. What she did is case studies of people that died by suicide. And so the first case study was about this young guy that was in the Air Force Academy, one of the leaders of his class, gifted person, left by all. His senior year, he had a psychotic break, and he could not get his commission. And his friends, his family stood by his side as he continued ill, he devolved, and he died by suicide. And like I said, he sounded just like Colin. And after that, I got more realistic. I mean, it's just so hard to face these kind of illnesses. And I got realistic in a good way because I started really considering that he could die. And that was hard and very painful, but it was true. And I needed to be more grounded in that. It even crossed my mind at that time that both my sons could die. And this was really a spiritual turning point for me. And I did seek other types of care. I actually started going to Al-Anon at this time. And every time they said alcoholism, I said bipolar disorder. It really helped me. We were desperate for treatment. I was scouring the literature like a doctor, like somebody studying for a med school final. And at this time, I learned about this guy, Fernando Goes at Hopkins, that does these genome-wide association studies for psychotic bipolar disorder, and read all his work. And I started reading about neurostimulation, transcranial magnetic stimulation, transcranial direct current stimulation. And I knew a lot about TMS because it's FDA indicated for migraine. Colin did not want to have ECT. It certainly would have been appropriate because he was afraid for his memory, and he ultimately did go on and have TMS. During this time, and during a lot of this time, I actually had a fantasy I could save their lives. But more about that. But think it's a natural reaction, but it's hard, and that's something that's difficult to work through. So during this time, finally what happened is Austin was worsening. He was hypomanic. He wouldn't, can't make an adult do anything really, and he wouldn't go to the doctor. And he had returned to UNO, decided he wanted to graduate, and he was found at UNO by the campus police cutting down shrubs with a machete. And he was confused and dirty. And it's amazing campus police didn't shoot him. I'll never know. I mean, he had a weapon. Of course, I'll never know all the details of what happened. They didn't arrest him. I mean, it would have been good if they would have, or at least called an ambulance. But like I said, we'll never exactly know what happened. But later that day, he was found wandering in City Park. And he was able to tell these people his address, and they brought him home. And I was able to get him. But this wouldn't be the last time that a stranger saved one of my son's lives. One of their lives was saved by a nurse who saw him acting unusually in public, a social worker who saw his name, looked me up on the internet, and called my office. The basic goodness of people was really beautiful, and it happened time after time. We certainly had a lot of problems, a lot of failures, but a lot of basic goodness came forth also. I'll use this time to just list some of the problems we had with our inpatient psychiatric experience in Louisiana. But I want to say first that we had excellent outpatient care, but we had very serious problems with inpatient psychiatric treatment. There were HIPAA violations. My son Austin burned his hand terribly in the hospital. Nobody noticed till I came to visit that evening. One of them had facial burns every day. I asked for wound care. It never happened the entire hospitalization. Once one of them was admitted under a coroner's commitment to an out-of-network facility. We ended up with an $8,000 bill. We had coverage denials, inappropriate discharge plans. One of them didn't show up to outpatient care for a week and a half, and I was never notified. So we had very difficult problems with that part of our care. Anyway, after Austin became psychotic at UNO, he was admitted to Minivers. And then after I thought about that, he had had attenuated psychotic symptoms for years. He had a slowly progressive, indolent course starting with his first depression at 18. Then he had the depression, the substance abuse disorder, and finally the illness manifested in its fully expressed form as an episode of bipolar psychosis. When he was at Minivers, his MRI revealed box-heart ventricles, and actually he had developed a trace psychosis that none of us could ever explain. My medical training helped me in a way I can't imagine anything else could have, because I had actually seen families with 2 children with birth defects. I mean, we had Huntington's Clinic. I had seen families with homozygous Huntington's disease, families with BRAC disease, families with multiple members that had Duchenne's muscular dystrophy. I mean, I knew I'm a human being. None of us are any different than them. It doesn't make it any... I felt less alone having seen these things. I felt less... it helped depersonalize it in some ways. Like, of course, this suffering's terribly personal, but yet there's something impersonal about these genetic illnesses. And that did relieve part of my suffering. Also, I began to think about having more than one family member die. And I took strength in the fact that other people had survived that. And I began trying to tell myself that I could too if it happened. I had a great spiritual advisor that helped me immensely, but that's the subject for another talk. And by this time, what happened is I didn't think so much I could save their lives, but I thought I could do the next right thing, that I could make the decision that was needed at that time. And my husband, Thad, said, you can do everything right, and they can still die. And I knew he was right. And being grounded in reality is helpful. Because it's a better place to start when things go bad. That's the best way I can describe it right now. During this time, known and treasured characteristics of my sons disappeared. They drifted against their will, their ability shredded. I saw their mental illness rack their bodies. It's amazing to me that people still don't think the brain is an organ. I mean, I literally saw their bodies change. They looked ill. I mean, and when you guys go on the board, you'll see that people are psychotic. They have a certain look in their face. I think what was hardest to tolerate for me during this time was the helplessness. But again, my medical training helped me because I knew that most illnesses do respond on a bell-shaped curve. You have your super responders, your intermediate responders, and your non-responders, right? People have hypertension, they lose 10 pounds, they don't have hypertension. Some people respond to one drug, other people get 4 drugs and they die of the complications of hypertension, and these brain illnesses are no different. I was very lucky. I have to talk about my nurses. Nurses are amazing because they understood mental illness already. And all the nurses close to me helped me unbelievably continue to work and manage my clinic and be very dear friends, and I will be forever grateful to them for that. You know, ECT can cause manic episodes. And that's pretty well known, but there are actually case reports about TMS causing mania. And Colin ended up not being that good of a TMS responder. And he had TMS on a Friday and attempted suicide on a Sunday. And when he went to the hospital after that suicide attempt, he had a therapeutic lithium level. And this is really discouraged because I knew he was taking all his medicines and he had flown into a mania and attempted suicide. And while at that hospitalization, he had taken a Seroquel overdose and was found to have a prolonged QT syndrome. That was probably physiologic. And I was watching him watch the doctors talk about that prolonged QT syndrome. And 2 weeks after that, he took 3 months worth of Seroquel because he knew it would stop his heart, and it did. And of course, that was horrible, but my first thought was, Austin was still hospitalized at Vinegar's, and what worse could happen to him during this time? It was really hard because what he said was, we could have fought this together. He missed his brother. And the disease did manifest differently in them because Austin had, I still have trouble saying his word after all these years, and anosognosia. He really had a poor insight into his illness, and he didn't take his medicine very well. This is a brain-based lesion. I mean, it's a right-sided lesion. This is the explanation for why people don't take their medicine, why addicts don't think they're really addicted, and a lot of even medical professionals are so judgmental against people for being non-compliant that there may be, and I think many times there is a brain-based explanation for their quote non-compliance that aggravates us so much. Maybe I should keep that in mind sometime. I really did appreciate the way they handled that at Vinegar's because they just were so good. They were not judgmental, but they were clear in a really beautiful way. So during this time, Austin had 6 hospitalizations in 11 months. He went back to Vinegar's for a second 3-month episode, admission. And there he got all the medicines. They knew he was compliant. And I was attended another poor prognosis talk where they said they were now seeing the full genetic presentation of his illness, and there was a genetic basis for his non-response based on his brother. And he continued to have psychotic intrusions, and they did entertain schizoaffective disorder, but they just really came down to saying he had that really bad bipolar disorder. And by this time, I spent enough money on psychiatric care to buy a nice-sized house. There were other suicide attempts and hospitalizations, and Austin was even put on Invega, which I thought was a really good choice. That's the long-term deductible for people that are non-compliant. But even on that, he didn't really do better. He just went into a treatment-unresponsive depression with severe drug side effects. It gave me mouth, cognitive slowing, incoordination, decreased concentration, and weight gain. But the lack of efficacy was a nightmare. Maybe he could have taken all that if it would have worked for him. He wouldn't get out of bed, wouldn't bathe, and he did go to IOP, outpatient treatment. Colin had only been dead for 9 months at this point. And, I didn't ask him too much about his medicines. I just tried to take care of him and, not get into the battle struggle with him over his medicines. But one day we talked, not long before he died, And he said, you know, the medicine slow all my thoughts. It's just the wrong thought that it slows. I still have all my crazy thoughts. It'll make me laugh because you've got to have some black humor. Austin was looking for an opportune moment, and he found one. He left the house, drove to a gun store, bought a gun, drove to a hotel, checked in, called 911. He said to the operator, tell my mother that I love her, and he shot himself. That's how his life ended. Every psychiatrist that treated either of my sons has expressed their guilt and their helplessness. I mean, you know, I've had, as a doctor myself, I've had patients die, especially in general neurology, but I felt like they died from their disease. They had terrible strokes. I hope that now in psychiatry training and in all medical training, there's more help for the doctors when the patients die. We didn't get much of that, and I hope that's improving. But the psychiatrists that treated my sons all, I know had a lot of pain about their deaths, and I appreciated them sharing that with me. I felt like they got the best treatment they could. After their deaths, I donated their DNA to the Johns Hopkins Genome-Wide Association study that Dr. Fernando Goes conducted. I talked to him on the phone, and I was grateful that the coroner department was able to send blood for both of them, particularly because they had excellent records with all the neuropsych testing, because so many times the diagnoses are uncertain. So I hope that that can help one day lead to better treatment. Also, there are not enough brains for people that are affected by mental illness for study. Many people that die of suicide die in conditions where their brain is not available for donation, as both of my sons did. But their brains are needed of unaffected and affected first-degree family members. So at the time of my death, I arranged to donate my brain to the Harvard Brain Tissue Research Center, and I urge you guys to do the same. So what's the current state of affairs? Our basic science, though still evolving, is in its infancy and limited. Our treatments really are rudimentary and awkward. We've fled the whole body with drugs that are difficult to tolerate, and we need elegant delivery tools just to a subset of brain cells. Affected patients, they're frightened, they're sick, they can only provide limited information, and for a myriad of reasons, they're too little known to their doctors, and those doctors are fallible, chasing ever-evolving information. What's required is a fully integrated response that aligns our societal emotions, imagination, intellect, and spiritual principles. We can all do something about the stigma surrounding mental illness. It affects not only the patients, but the family members, the loved ones, the friends. I think we are, as I said when I started, on the we're beginning an evolution, a societal evolution about empathy. You know, we need to ask people to suspend their judging mind, act in love, be ethical. Be ethical. I mean, it's really a matter of ethics. Don't discriminate against people about mental illness and talk unkindly about them. Each person in this room has a role to play. That's free. The other things we need are costly. And we'll have to decide as a society if we're going to pay for these things. On a federal level, we still don't have the community mental health care system I spoke of. We still don't have true parity of treatment of brain illnesses versus medical illnesses. What, the brain is not an organ? I'm just amazed by that. On the positive side, we have Senator Bill Cassidy, who has a personal interest in mental illness and has done some important things, and I believe he has a long-term commitment for, on the federal level, to work for improvement. On the state level, we still have such a problem with acute psychiatric care. It's tragically underfunded. I mean, psychosis is a brain attack, like a heart attack. It damages brain tissue. We need to be acting as such to save brain tissue. Jails are the de facto treatment system. Would you call a policeman if you had a broken arm? I mean, that's the fundamental, one of the fundamental flaws in the system. I will say that law enforcement education has been happening. I know there's a lot happening in that area, and that's a good thing. There's some other positive things. In St. Tammany Parish, there's Safe Harbor, which is modeled on the San Antonio system, where what you do is bring people that are in withdrawals or in psychiatric crises, Instead of putting them in the jails or the emergency rooms, they can go to acute stabilization. Also in our state, we need a constitutional convention to restructure the state budget to take health care and mental health care in particular off the yearly chopping block. We need better brain science. Our brain science is not where it needs to be. More research, more NIH funding. The pharmaceutical companies have not allowed suicidal patients into studies for psychiatric medications for decades. We have lost years of opportunity to collect data. I know there is some movement for that to change. We need to start now. I think eventually we do have some things on the horizon for treatment, which I'm not going to go into. I'll just name nanotechnology delivery systems, optogenetics, brain stimulation techniques. Maybe one day we'll do gene editing for those with mental illnesses using CRISPR-like techniques. There are some treatment modalities being talked about with the neuroinflammatory reflex. In conclusion, I'd like to say that my close witness of psychotic bipolar disorder in my sons has fundamentally changed my understanding of the brain, free will, the way human beings interpret reality, but it's also transformed my understanding of resilience, the capacity of recovery, and the ever-present force of love. So in my mind, I think back to Cheshire Cat smiles, their skinny legs swinging under the kitchen table, the giggles, a boyish conspirator, I yearn for them. Thank you. Any questions? If I can't answer, I will. If not, I'll defer. I'll be around afterwards if anybody wants to ask questions.
I just want to thank Dr. Khan again, and one of the things that I want to say in terms of something that reconnected us recently, you didn't speak to, that we talked a little bit about using narrative, telling your story, and that's something that I hope while our third-year students are on psychiatry, you'll have the opportunity to listen to people tell their stories. I know some medical schools, that's part of their curriculum, and I know we do that in our first and second years, listening to, we call them illness scripts, but also wellness scripts, and listening to people tell their stories. I appreciate that you shared your story here, but also want to let you know that her writing is award-winning, and the way we reconnected is that she had written a piece for the William Faulkner Festival, and my brother was a judge there, and she won for her writing. And I think your sharing today is very helpful to us as clinicians and future physicians. So I wanted to thank you for that. Another thing in terms of decreasing stigma, and I told Anne that I have used this in my class, when you put in an obituary in the newspaper for one of your sons, she described how he died secondary to bipolar disorder. And I think some of the folks that I have worked with and family members, to be able to say that and to be able to explain that and speak about that, it is helpful, hopefully, for the individual to get the support and community support they need, but also for the larger community to be able to identify, as you said, brain illness and ask for the help and support that's needed for that at every level, individually, in families, in groups, in society, and politically. So thank you again. Appreciate it.